Imagine waking up with a strange discomfort low in your belly, a tiny burn when you pee, a feeling that keeps pulling you back to the bathroom even when nothing really comes out. You tell yourself it's probably nothing, maybe just dehydration, maybe stress, but that quiet worry in the back of your mind keeps whispering, what if something's wrong? Today, in part 1, we're going to gently walk through the early signs, the hidden clues, and the real causes behind urinary tract infections, why they happen, who gets them most, and what risks you should never ignore. Because the more you understand your body, the faster you can protect it. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Most people think a UTI is just a burning sensation, but the story is rarely that simple. Imagine your urinary system as a quiet, well-protected pathway, from the kidneys, down the ureters, into the bladder, and finally out through the urethra. Everything flows smoothly, until bacteria slip in and disturb this peaceful system. Now let's see what those early warning signs actually feel like. A burning feeling when you urinate, a stubborn urge to pee even right after you've just gone, releasing only a few drops but feeling like you need to go again. Urine turning pink, red, or cola-colored, a silent signal of blood, and that dull pelvic ache that makes you feel off in the center of your lower abdomen. And while these symptoms are common, something important often gets missed, especially in older adults, where confusion or vague discomfort can take the place of typical symptoms. That's why paying attention matters. The symptoms can shift depending on which part of the urinary tract is affected. If the kidneys get involved, the story becomes more dramatic. High fever, shaking chills, nausea, vomiting, and sharp pain in the back or sides. Bladder infections feel heavier, with pelvic pressure and that relentless, painful urgency. If it's the urethra, the burning can be intense, sometimes with a discharge you weren't expecting. So when should you see a doctor? The moment these symptoms appear. A UTI is one of those conditions where early treatment can protect you from serious complications. Now here's why UTIs happen in the first place. Your urinary system is designed to keep bacteria out, but sometimes the defenses slip. Most infections start when bacteria like E. coli, which normally live in the gut, travel into the urethra. From there, they can multiply in the bladder, causing inflammation and pain. In some cases, sexual activity can bring GI bacteria closer to the urinary opening. Certain sexually transmitted infections can also infect the urethra. And some people experience recurrent infections, 2 or more within 6 months, or 3 or more in a year. Women experience this more often, and there are real reasons for that. Here's why women are more vulnerable. A woman's urethra is shorter. There's simply less distance for bacteria to travel. During perimenopause and menopause, falling estrogen levels change the natural bacteria in the vagina, weakening its protective barrier. And certain birth control methods like diaphragms or spermicides can increase risk too. But women aren't the only ones affected. Low fluid intake, not drinking enough water, allows bacteria to linger instead of being flushed out. Constipation pushes pressure into the urinary tract. If the bladder doesn't empty completely, bacteria get a chance to grow. Children born with reflux of urine back toward the kidneys, people with kidney stones, those with enlarged prostates, or anyone using catheters, all face a much higher risk. And when UTIs are ignored, complications can follow. Kidney damage that doesn't reverse. Early or low-weight babies during pregnancy, urethral scarring in men, and in severe cases, sepsis, a life-threatening reaction to infection. But prevention is a powerful ally. Staying well hydrated, choosing the right birth control, avoiding irritating feminine products, preventing constipation, or drinking cranberry products if your doctor agrees, these small habits help keep the urinary tract strong and protected. So here's the takeaway. A UTI is more than just discomfort. It's your body's way of asking for attention. Understanding the early signs, knowing the risks, and recognizing what's normal for your body can help you act quickly, stay safe, and avoid complications. You're not alone in this journey, and with the right information, you can prevent recurrences and protect your health. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing. And in part 2, we'll talk about the diagnosis and treatment of UTIs, what tests matter, how antibiotics are chosen, and what really helps you recover faster.